Hi there, Canagran again. I'm Jill Charles, registered nurse and cannabis nurse coach. This is the second part of our series looking into depression for Mental Health Awareness Month. In the last part, we talked about exactly what is depression, and today we will be discussing several different techniques in helping to cure depression. We will be looking at both conventional therapies and newer cannabinoid therapies that are available for treatment. So let's get into it. Luckily, depression is extremely treatable. First of all, we're going to talk about antidepressants. These can take a few forms and are typically prescribed by your psychologist. The downside of these, however, is that it may take several weeks for your body to adjust to them, and you will get used to the dosage and have to have it changed. The main traditional medications take several forms. There are selective serotonin reuptake inhibitors, SSRIs. These prevent serotonin from being reabsorbed. This means more serotonin remains in the synapse, so signal transmission becomes easier and more frequent. This is thought to be the action that improves depression in some individuals. And then there are serotonin and norepinephrine reuptake inhibitors, SNRIs. These drugs are similar in mechanism to SSRIs, except of course they inhibit the uptake of serotonin and norepinephrine. Increasing serotonin and norepinephrine levels can improve mood, energy levels, and focus. And then there are tricyclic antidepressants, or TCAs. These are older medications used to treat depression by increasing the availability of serotonin and norepinephrine in the brain. They are no longer usually the first choice due to potential side effects and overdose risks. Now we can move on to atypical antidepressants. Unlike the traditional antidepressants, which primarily increase the levels of serotonin and norepinephrine in the brain, atypical antidepressants work through various mechanisms, including blocking or activating specific receptors in the brain that regulate neurotransmitter release, increasing dopamine levels in the brain, or increasing melatonin levels, the hormone involved in sleep regulation. Side effects of depression medications, however, are numerous and are the reason many people do not want to take them in the long term. They include such things as gastrointestinal issues, sleep disturbances, headaches, sexual dysfunction, decreased sex drive, weight changes, anxiety, dry mouth, dizziness, fatigue, increased heart rate, tremors, blurred vision, and confusion. More concerningly, there are some serious side effects, such as serotonin syndrome. This is a life-threatening condition caused by high levels of serotonin in the body. Symptoms of this include agitation, confusion, hallucinations, seizures, and coma. Seek medical attention immediately if you are experiencing these symptoms. There can be suicidal thoughts or behaviors. SNRIs can increase the risk of suicidal thought or behavior, especially in young people. And this is most common during the adjustment period, when first starting or switching medications. There are also other types of therapy when it comes to depression. CBT, cognitive behavioral therapy, is thought to be helpful for depression also. This focuses on recognizing and correcting unhealthy thinking patterns with the aim of changing thoughts and behaviors towards responding to challenges in a more positive manner. Systemic therapy is based on the assumption that relationships between people, especially those within the family, play an important role in the development and treatment of depression. The therapy is intended to help family members communicate better and give each other more support. Lifestyle changes can also be important. Having exercise, sleep, healthy eating, and avoiding alcohol and caffeine can play a major role in alleviating the symptoms of depression. Electroconvulsive therapy, or ECT, is considered for major depressive disorder that is treatment resistant, or severe depression that poses immediate risk to the safety and well-being of the patient or others, or catatonia, a state of extreme withdrawal and immobility. This can be highly effective in depression, with 70 to 80% of patients obtaining remission. Now we're at the part of our video when we get to talk about cannabis and depression. It is important to remember, if simple tasks feel overwhelming and activities you once enjoyed no longer bring joy, it is important to seek help as soon as possible. So how does cannabinoid therapy work? Medical cannabis works with the body's endocannabinoid system to alter the intensity and frequency of symptoms associated with many conditions. Medical cannabis is not a cure or a first-line treatment for depression, but for those who have failed to find relief, it may help for debilitating symptoms such as low mood, poor sleep, low energy, and lack of concentration. The evaluation of medical marijuana for depression is still in its early stages. Right now, researchers share that possible benefits include the restoration of normal endocannabinoid function and mood stabilization. Scientists at the University of Buffalo have been focusing specifically on brain chemicals called endocannabinoids. These are naturally produced chemical compounds. Endocannabinoids play a huge role in motor control, cognition, emotions, and behavior. They also have a similar makeup to that of cannabis. The research has shown that chronic stress may suppress the brain's production of endocannabinoids, and this can lead to depression-like behavior. Research also demonstrates that increasing the endocannabinoids in your system via cannabis can return things to a normal chemical balance. This is resulting in a clinically significant reduction of depression severity. Medical marijuana is well tolerated and has a dropout rate comparable to those in clinical trials of antidepressant medications. Findings are consistent with other research into the use of medical cannabis for depression. In a 2022 study published by the journal Psychiatry Research, a survey of more than 7,000 patients with symptoms of anxiety and depression reported sustained improvements following the use of cannabis. And a separate study published last year in the journal Biomedicines found that sustained use of prescribed cannabis products is associated with significant reductions in pain, depression, and opioids amongst elderly patients. To end, more studies are needed to assess the true benefits and disadvantages of marijuana as a potential therapy for people with depression. It may be helpful in combination with other therapies, and a holistic approach is often the most appropriate. Speak with your healthcare provider. Book a cannabis nurse coaching session with us to explore your options. Remember, you don't have to be high to be healthy. Like, comment, and subscribe to stay in the loop with us and our education. Have a wonderful day, and we will see you next time.